If you're in medicine, nursing, or pharmacy, you already know that pharmacology can feel like an impossible memory test. Well, today, we are going to make it a whole lot easier. We're tackling one of the trickiest topics out there, cholinergic drugs. Right? Does it just feel like this never-ending list of drug names, side effects, and uses? I promise, you are not alone in feeling that way. But what if there was a way to bypass all that rote memorization and actually understand it? Well, there is, and we're about to jump right in. So here's our game plan. We're going to start with the big picture, this idea of a balancing act. Then we'll meet the two teams of drugs, Team Go and Team Stop. We'll see what happens when things go wrong with each, and then I'm going to give you the secret weapon to remember it all.
Okay, to really get a handle on these drugs, I want you to picture the entire cholinergic system as a car. That's it. It's all about a simple balance between two things, a gas pedal that makes it go and a brake pedal that makes it stop.
This right here is the absolute key to everything. On one side, you've got the agonists. Think of them as the gas pedal. They either mimic or boost the body's natural go signal, acetylcholine. Then on the other side, you've got the antagonists. You guessed it, the brake pedal. They block that signal, telling the system to slow down or stop. If you can just lock in this one idea, you are seriously halfway there. All right, so let's meet our first team, Team Go. These are the cholinergic agonists. Now they're kind of clever. Some of them push the gas pedal directly, while others are more like a support crew, making sure that pedal stays floored for longer. First up, the direct acting guys. And to remember them, we've got our very first mnemonic. I know, it sounds completely bizarre, but I guarantee you will never, ever forget the sentence, Bethany takes meth pills to cut carbs. So let's connect the dots. Bethany is for Bethanechol, which we use to get the bladder moving again. Meth is for methacholine, which is used in diagnosing asthma. Pills is for Pilocarpine, a huge one for glaucoma and dry mouth. And finally, carbs is for carbachol, another go-to for glaucoma. See how that works? A totally weird sentence just became a rock-solid clinical tool. So what about that support crew I mentioned? These are the indirect acting agonists. Instead of pushing the gas pedal themselves, they do something different. They basically take out the enzyme that cleans up acetylcholine. So the body's natural go signal just hangs around way longer, making the effect much stronger. And you know we've got a mnemonic for these two? To remember the big ones, all you have to do is think, physicians never prescribe enough drugs. Let's run through it. Physicians is for physostigmine, which is actually the antidote for an antagonist overdose. Never and prescribe are neostigmine and pyridostigmine. Both are essential for treating myasthenia gravis. Enough is edrophonium, which helps diagnose myasthenia gravis. And drugs is for donepezil, a major player in Alzheimer's treatment. Okay, so we've got the gas pedal figured out. But what happens when that gas pedal gets stuck to the floor? What happens when you have way too much of that go signal flooding the system? Well, that's where we get into some real trouble. Clinically, this is called a cholinergic crisis, and it is a true medical emergency. It happens when there's a massive excess of acetylcholine, maybe from an overdose of these drugs we just talked about, or even from exposure to certain pesticides or nerve agents. So how in the world do you recognize it? Well, thankfully, there is an incredibly useful mnemonic that pretty much every clinician learns to spot the signs instantly. All you have to remember is the acronym DUMBHAVES. And this acronym is just brilliant because it tells you exactly what's happening. The body's rest and digest system goes into absolute hyperdrive. You've got defecation, urination, muscle twitching, and bronchospasm, which makes it really hard to breathe. Then for halves, you've got heart bradycardia, a super slow heart rate, autonomic stimulation, vasodilation, eye pupils that constrict, and finally secretions, just secretions everywhere. Saliva, tears, you name it. It is a total system overload. Phew. Okay, let's totally shift gears. We have met Team Go. Now it's time to meet their direct opponents, Team Stop. These are the cholinergic antagonists. Their entire job is to block the receptors and slam on the brakes. Now, pharmacology isn't always polite, but it's almost always memorable. And to remember the core drugs that hit the brakes, well, the mnemonic is simple, it's direct, and you will not forget it. It's A shit. Let's quickly decode it. A is for atropine, a classic emergency drug for a dangerously slow heart. S is scopolamine. Think of the patch for motion sickness. H is homotropium, used for eye exams. And then I and T are ipratropium and tiotropium. Both are essential inhalers for diseases like COPD and asthma. But that's not the whole crew. there's another important group of brake pedal drugs you need to know. And for them, just remember this little phrase, Ben's Oxy Glyco Trip. So Ben here is benztropine, which is used for Parkinson's. Oxy is for oxybutynin, which helps calm an overactive bladder. Glyco is glycopyrrolate, often used to dry up secretions before surgery. And trip is trihexyphenidyl, another drug used for Parkinson's. So we know what happens when the gas pedal gets stuck, but what about the opposite? What happens if you slam on the brakes way too hard and you just keep them on? Well, blocking the cholinergic system too much causes its own very unique and very dangerous set of problems. And for this, we have one of the most classic, most vivid mnemonics in all of medicine. It paints a picture that is impossible to forget. Hot as a hare, because you can't sweat, so your temperature goes up. Blind as a bat, because your pupils are wide open. Dry as a bone, because all those secretions have been turned off. Red as a beet, from flushed skin. And mad as a hotter, which describes the intense confusion and delirium. So you see, all these phrases that sound kind of silly are actually incredibly powerful. They're cognitive shortcuts. They transform the nightmare of rote memorization into real clinical understanding. They are basically your new superpower. So let's just put it all together on one screen. This is your ultimate cheat sheet. On the gas pedal agonist side, you've got drugs like Bethanechol, and when things go wrong, you look for DUMBHAVES. On the brake pedal antagonist side, you've got drugs like Atropine, and when they go overboard, you look for hot as a hare. It all always comes back to this simple balance. And that's our whirlwind tour of cholinergic drugs. We covered the gas pedal, the brake pedal, and exactly what happens when either one of them fails. So the only real question left is, which one of these mnemonic superpowers are you going to master first? Thanks for sticking with me.